Hello, I'm Dr. Bertram Kaper. This video is a short overview of hip replacement and the combination of the Verilast technology that's used for hip replacement surgery and the direct anterior approach that I use for my hip replacement patients. Primarily designed to relieve the disabling pain of hip arthritis, hip replacement surgery is designed to improve your quality of life and restore the active lifestyle that you used to enjoy. For the purposes of today's discussion, we'll be focusing on two primary issues. The first are the materials that we use to replace the hip, and the second is the surgical technique that I use for hip replacement surgery. Just like your natural hip, the back and forth movement from day-to-day activities can cause wear and tear on the artificial hip replacement. Our goal is to try to minimize the wear, to minimize the long-term problems with that, and maximize the longevity of hip replacement surgery. Traditionally, hip replacement surgeries are made out of a combination of materials. The femoral head is replaced by a metal made out of cobalt and chromium ions, or a ceramic material, both of which can offer long-term benefits to our patients. Ceramics are very durable, they're very smooth, and they can reduce the friction and wear within a hip replacement, but because they are brittle, there's a risk that the ceramic could fracture. If a metal is used for the femoral head, typically this is an alloy made out of cobalt and chromium. This is a very durable material that is not prone to fracture, but is not as smooth. It can cause increased wear on the plastic that we use. The Verilast technology that I use for my hip replacement patients combines the best of both worlds. We have the oxidized zirconium or oxinium, which is very durable, smooth material that is not subject to the risk of fracture, combined with XLPE, which is highly crossing polyethylene. And this wear couple, as we call it, significantly reduces the friction within the hip. Thereby, the wear and tear is diminished and the life expectancy of the hip replacement is increased. While oxinium or oxidized zirconium has been shown in the lab and in our patients to improve the wear characteristics of hip replacement surgery, it's really the combination of oxinium with a newer material known as XLPE. Recently, an aggressive protocol was employed to test the durability of our hip replacement implants. The hips were taken into a hip simulator, which reproduces the natural function of the hip, and cycled for 45 million cycles, which is 9 times the industry standards and the equivalent of probably 25 to 30 years of day-to-day use for our patients. When compared to an implant made out of the metal, cobalt and chrome ions, the oxidized zirconium and XLP combination reduced wear by 67% at 45 million cycles compared to 5 million cycles with the standard metal head.
The reason I chose the Verilast hip technology was because I really felt like I needed to have something that was durable and long-lasting so that I wouldn't have to have another hip replacement down the road. As I said before, I had polio as a child, and so I literally don't have another leg to stand on, and so to me that was a very important aspect.
When it comes to the surgical technique for hip replacement surgery, the technique I recommend is what's known as the direct anterior approach. I have found in my experience that this offers a much faster and quicker recovery for a majority of our patients when compared to the traditional posterior approach. During the direct anterior approach, we position our patients flat on their back on the operating room table. We make an incision which is typically about 8 or 9 centimeters or about 3.5 inches on the front part of the hip. We then divide the muscles to gain access to the hip and then allow the muscles to come back together after the surgery is complete. In contrast to the direct anterior approach, the more traditional posterior approach cuts muscles in the process of replacing the hip. When we compare the outcomes of hip replacement surgery done either with a direct anterior approach or a posterior approach, we find similar long-term outcomes, but it's really the short-term benefits that I find my patients benefit from the most. With the anterior approach, we try to minimize the amount of muscle trauma around the hip. No tendons are cut in the process of doing the surgery. Therefore, the patient experiences less postoperative discomfort. That facilitates an earlier recovery, and an early recovery translates to a happier patient.
The recovery was very quick. I was able to get out of bed that night And I also was able to walk up and down the steps. I left the hospital the next day, so I was in the hospital one day. And I went home, walked up my steps, got to take a shower, which, that's very important, and got to be in my own home right after the surgery.
It is important to remember that hip replacement surgery is still a major surgical procedure. There are real risks associated with this operation that need to be discussed thoroughly prior to any decision being made to proceed with surgery. The combination, however, of a direct anterior surgical approach and the Verilast technology that we offer our patients facilitates what we feel is the best outcomes both in the short term and the long term.